All right, we're live. Delegate Rosenberg, you can begin.
Thank you. Welcome to the Government Operations and Health Facilities Subcommittee for today's briefing. This is a virtual subcommittee briefing, so we ask for your patience if we encounter any technological or streaming issues. Before we begin, I wish to remind subcommittee members that this briefing is being made available to the public, streamed on the General Assembly's YouTube channel. Subcommittee members will be muted throughout the briefing. If you have a question after each panel presentation, type question in all capital letters into the chat, and I will call on you to ask questions. After I call your name, please wait a moment while Dylan unmutes your screen. Remember, even though we are meeting on Zoom, please adhere to our usual committee rules of one question and one answer from the panel, not one question and one answer from each individual panelist. Also, please keep your questions shorter than the expected answer. Today, the subcommittee will hear an update from the University of Maryland Medical System and receive briefings on the Open Meetings Act and Public Information Act. Our first panel will provide the update for the University of Maryland Medical System. We'll be hearing from Donna Jacobs, Senior Vice President of Government Affairs, Lisa Atkins, Senior Vice President and Chief Compliance Officer, and Aaron Rabinowitz, Senior Vice President and General Counsel. The presentation will be followed by question and answers from committee members. For our second panel, we will receive a briefing on the Office of the Public Access Ombudsman from the Ombudsman, Lisa Kirschner. This presentation will be followed as well by a Q&A session. Finally, next, a briefing on Public Information Act Compliance Board from Chairman John Butch West and Board Member Darren Wigfield, again followed by a Q&A session. Finally, a briefing on the Open Meetings Compliance Board from the board chair, Lynn Marshall. This presentation will be followed by a Q&A session. Panelists, please keep in mind, everyone, not just panelists, this briefing is scheduled to conclude by 3 o'clock. Panelists representing the University of Maryland Medical System, welcome. When you're prepared, you may begin. Thank you.
Thank you. Can everyone hear me?
Yes.
Thank you, Mr. Chairman, members of the committee, and thank you for the opportunity for us to speak today to provide you with an update about governance at the University of Maryland Medical System. I am Donna Jacobs, Senior Vice President for Government Affairs, Regulatory Affairs, and Community Health at the system. And I am joined today by two of my colleagues, Lisa Atkins, Senior Vice President and Chief Compliance Officer for the entire system, and also Aaron Rabinowitz, also Senior Vice President and General Counsel for the medical system. Both Lisa and Aaron are new to their roles. They were hired for their expertise and because of the governance challenges that we've had and that we faced and that we've addressed over the last year and a half. Each of them has helped substantially to shape and shepherd much of the best practice governance and management reform that we're about to describe. Lisa, in her short tenure, has already built out a very laudable corporate compliance program, and Aaron has held responsibility for adherence to the legal requirements in the legislation that this body passed in 2019, as well as supplemental reforms directed by the board related to its practices, policies, procedures, as well as many of the reforms driven by our new management team. The committee knows who we are. We're the medical system, 13-member hospital system, private nonprofit with 28,000 employees, providing on average 25% of the hospital-based care that's delivered in this state. I won't belabor that, but I will say to you, we are a new and a different entity than we were some months ago, not simply because of the governance issues that we're certainly going to talk about, but because of the challenges and struggles that we've endured related to COVID-19. I know many of you were on the joint committee or part of the joint committee meeting this morning, so you heard a little bit about the work that's going on related to vaccines, but this has been a long haul, if you will. We've partnered with the state to deliver the best levels of care possible to COVID patients, including hotspots in Prince George's County, Northern Anne Arundel County, and Baltimore City. We've not laid off any employees, not furloughed any employees, despite declining volumes, which we saw for many, many months. And we've been integral in partnership with the state in standing up the convention center, the field hospital, standing up the Lord Baltimore for people who need to be quarantined but don't have a way to do that safely at home, and providing an additional 135 inpatient beds, preparing for the surge at UM Laurel Medical Center. Before asking my colleagues to comment, let me do just a high-level review for you. Many of you have been engaged in following along with us and providing advice and being helpful for a very long time, and also just set the stage for some of the more recent work that Lisa and Aaron will describe. So as you likely know or would expect, much has happened since March of 2019, when the allegations about board members with potential conflicts of interest were raised. The board members were placed on leave. Many resigned immediately. Some resigned at a later point. None serve on our board at this time. 5 key senior level executives, including the then president and CEO, left the system. And you'll recall, because John Ashworth came and presented before this committee on an early Saturday morning toward the end of session in 2019, John became the interim president and CEO. Chip DePaula, whom most of you, if not all of you, know, was named chairman of our board, and Dr. Mohan Santha became the new president and CEO effective December 1 in 2019. In the spring of that year, the remaining board members at that time hired a national corporate governance expert to review the policies and procedures related to board conflicts of interest and to issue recommendations in line with industry best practices. A new conflict of interest policy was adopted in May of 2019, shared with the governor and the legislature, and then subsequently all of our member hospitals adopted that COI policy. The board set up a new governance and nominations committee, which in turn hired special governance counsel, who at that time was Aaron Rabinowitz, and he's now been promoted, elevated to general counsel for the system. So the nominating committee, together with special counsel, engaged a nationally renowned governance expert to review our board policies and procedures and to provide best governance recommendations. You'll remember that the legislation that you all designed called for termination of our board members' terms, a third, and a third, July, October, and December. That occurred, and by January of this year, an entirely new board was seated. All of those members went before the Senate Executive and Nominations Committee. They were vetted there and ultimately approved. In September of 2019, the board formed a special committee comprised solely of new board members who had not served on the board prior to July 1 of 2019. And that committee engaged Latham and Watkins, which is a national law firm, together with forensic accountants, and the two were collectively termed the investigative council. They were asked to conduct a forensic audit of board member financial transactions with the medical system, review the adequacy and effectiveness of the board's governance policies and practices, and make recommendations for improvement, remediation, and corrective actions as deemed necessary. The work of that special committee and that outside investigative council was completed in December of 2019. The governance and nominating committee that was created earlier recommended the adoption, and it has been implemented, of a governance handbook, which included a replete set of new and or amended policies relating to board member ethics, standards, and management oversight. Pursuant to the legislation, there were 2 other reviews and investigations. One was conducted over several months by the Office of Legislative Services, and it was a review of board member related party transactions dating back to 2016 through the effective date of the legislation, and also pursuant to your legislation, of financial management practices and audit report, which we call the performance audit, was completed by an external CPA firm that was obtained through a competitive bid process, and that report was issued in December of 2019. The OLA ultimately concluded that if the recommendations of that special committee and the investigative report and the performance audit were successfully implemented, no further recommendations regarding procurement and contracting practices would be necessary. So there were 24 recommendations in that special committee report and several in the performance audit. They have all been implemented, and they were all completed well before October 1, which, according to budget language this last session, we needed to report on in order to receive additional funds cited for shock trauma. And that more current work is summarized in a letter of September 21st of 2020, a letter and a report that went to the budget committees and the House and Senate side, and also to the Audit and Compliance Committee. And we shared that letter with staff should you want to see it. So at a very high level, the work and the recommendations related to those last two reports that OLA deems so critical and central can be categorized into four categories: financial conflicts of interest, board governance and structure, creating a robust corporate compliance program, and corporate culture related to compliance. I should say we've evolved, which is where I began, quite a lot through collaboration, through listening, through learning, through education, through melding our culture, and through process mediation. We've spoken to the legislature, we've spoken to many legislators individually, certainly to leadership in both chambers, to the administration. We've learned a lot and depended a lot on outside experts, not affiliated with this organization. And we certainly have now a very engaged and committed board, responsible and responsive to conflict of interest issues and considerations. And with that, maybe I can ask both Lisa and Aaron to summarize these efforts. We're not going to go chapter and verse through the report and the letter that we've given, but what you will hear is now deemed a best-in-class governance structure. So again, a new organization, we're in a new place. And of course, we'll be happy to answer any questions that you might have at the conclusion. Maybe Lisa, we can start with you.
Sure. Thank you, Donna. And thank you for inviting us here. As Donna mentioned, I started with UMS. I'm relatively new. I started in the midst of the pandemic. I am marking my 6th month here at UMS. Having come from, I have, just for background, I have more than 25 years of experience in building best-in-class compliance programs with a particular focus with organizations who have post-corporate integrity agreements or settlements with the Department of Justice. And most recently, before coming to UMS, I was at Children's National to help them build their best-in-class compliance program after a settlement with the Department of Justice. And prior to that, I was at Kaiser Permanente, helping them build both their regional and national compliance programs. So from my perspective, coming to UMS, it was an opportunity to help build and help the organization move forward. I will say I'm a nurse by background, so I tap into my nursing background to help heal organizations as I come into these types of situations. But from my perspective, I view this as a fresh start for UMS with a reconstituted board with a few legacy members. But the new members that have been appointed have significant experience in board governance and best practices. And as Donna mentioned at a high level, the issues at UMS and out of the special committee report and the OLA report fell into 4 buckets: board structure and governance. And I'll defer to Aaron to talk a little bit more about that. But my areas are conflicts of interest as part of the compliance program. And the conflicts of interest, the goal was really to drive that strong compliance culture throughout the system. And we did that as we moved forward. I put in the COI policy that was adopted prior to my arrival that has also been adopted consistently throughout the organization at each of the member organizations. As I onboarded to UMS, I did validate those policies adoption and how we've implemented them. We've looked at people, process, and technology. From a people perspective, to be able to do an effective COI program, we've hired into the compliance department. We've leveraged that. We also have outside assistance when needed. As part of the process, we built a new process, including a new form, a questionnaire that will capture the necessary information for us to be able to identify potential conflicts, and then also how to decide how to manage those conflicts. We've also built in an auditing process so that we go back and validate that the processes that we put in place are working effectively and did what we thought they would do. We've also tied that conflicts of interest policy to a new contracting policy that has been adopted system-wide. We now have a part of that process for contracting is to include that COI questionnaire that identifies if there's any potential conflicts with someone asking to bring on a new product or a new service. If a potential conflict is identified, it gets escalated up to compliance, where we then investigate to determine if a true conflict is present. We've also launched a new electronic platform to streamline our COI process. We did have another external review investigation of our member organizations. And out of that report, and also in the special committee report, was an identification that there was not a central collection of those COI questionnaires by board members and leaders. We now have that platform, that we have that central location collection, and all responses are collected electronically. We do not accept any paper responses. So again, that also allows us to centralize review through the corporate compliance team. It also allows for more timely review of the disclosures. Including in that process, new to UMS this year, is the implementation of those management strategies when a disclosure comes forth and a conflict's identified. So we now have these written conflict management plans that we implement where appropriate. But part of that is also the reporting of those disclosures in the conflicts, in the recommendations to manage those conflicts and identify whether those conflicts are manageable or not. From that perspective, we have the oversight of the board and key executives. At the board level oversight, we have convened a subcommittee that reviews all the conflicts of interest in the disclosures and potential conflicts that arise. They make recommendations up to the Audit and Compliance Committee, who then also reviews it and then makes a recommendation to the full board as to whether or not it's an acceptable risk or an acceptable conflict and whether or not it needs to be managed. That then gets reported to the full board. As part of that process, though, we also go back to each of the member organizations, and any disclosures from their board members and their leaders and their management team are also vetted through each of those organizations and their governance and nominating or their audit compliance committee, and then to their full board with recommendation back to the UMS board. Part of that too is the compliance program and the commitment of the board to build that culture of compliance throughout the organization. And to do that, we've done a couple of things. We have enhanced our training on conflicts of interest, and we have rolled out, since my arrival, risk-based training with a special focus initially on the authority to commit in our contracting policy as well as conflicts of interest. And we're now taking that to what I call conflict of interest training 2.0. We're also taking that to middle management and frontline staff. Part of building that culture of compliance is also making sure that our employees feel comfortable in raising their hand and letting us know if they have a concern or they see something or amiss or something, a concern that they would like to have addressed. Part of that also included updating our whistleblower policy, again, to tell employees at all levels that if they're not comfortable talking to their manager or calling compliance, they can call an anonymous hotline. We've done a great deal of education from that perspective. But I think from my view is I prefer that they feel the comfort in calling us, but we do want to have them have an outlet in case they don't. We also looked at some of the, as part of the culture of compliance, we've also built in that messaging from the top. As many of you know, the tone at the top sets the culture for the organization. And I think it's critical to the success of UMS to have that commitment by the board and leadership to create that robust compliance and ethics program in that culture. So as we do that, we've had messaging from both our board and senior leaders about why compliance is important, how we set that culture going forward, with the goal that we want our 28,000 employees to be proud to be part of UMS, and how and educate them of how we're incorporating our culture of compliance and also leading to that openness and transparency of what we do. So part of that, again, I've mentioned the messaging, but we've also made those reports from both the NGRIN and the special committee available publicly on our website and in other areas. We also have the commitment of the board and leadership that we are going to go out and tell our story and the lessons learned that we had both at the national level and internally. At the national level, we've begun presenting what happened at UMS and the changes we made and how we're going to make it, how we're going to continue that journey forward. And most recently, we presented at a national organization, the American Health Lawyers Association, and our chair of the Audit and Compliance Committee joined me and others from other organizations to talk about what happened here at UMS and other organizations and how those governance practices can become stronger, particularly around conflicts of interest. So from that perspective, we've also talked about how our journey does not end with the remediation of those 24 recommendations from the special committee that were adopted by the OLA. We also recognize that building that best-in-class compliance and ethics program is an iterative process, and we will continue that journey as we go forward, which is, again, why we're here today giving you this update.
Thank you, Lisa. Aaron?
Yeah, thank you all very much for your time today. And I'll just add a few highlights around our governance practices to fill in with respect to things that Donna and Lisa have already touched on. The first thing I'll mention, when I joined the system in July of last year in my role as special counsel for governance, the first thing we did, and Donna mentioned, is we created a standing governance committee of the board charged with oversight of fidelity to best practice and governance policies and procedures and identifying any gaps. Over that time, we have adopted 15 board level policies to date. They cover things like conflicts of interest, code of conduct, the oversight of the corporate compliance program, management's duty to disclose, charitable contributions and sponsorships. And as Lisa mentioned, it's an iterative process. So this continues to this day. So for example, recently Brigham and Women's Hospital, part of the Harvard network, was in the news related to some activities with their CEO and activities with Moderna, outside activities of senior management. And whenever those things are in the news, we always re-examine with our governance committee, do our policies and practices address that sort of thing, right? Just because it didn't happen here doesn't mean it couldn't. And so we're constantly learning and trying to make sure we're doing whatever would be considered best in class. I'd also like to briefly highlight some of the structural changes we've made around our board and our governance practices. First, we have 10-year term limits that we instituted via a bylaws revision to ensure that we don't have really extended tenure where folks end up with sort of this sense of ownership of the asset as opposed to stewardship of the asset. In addition, we instituted term limits for our board chair and our committee chairs to ensure appropriate and healthy rotation of leadership. And in addition, we only have now disinterested directors can chair the key committees on the board. In this case, when I say key committees, I mean things like audit and compliance, governance, and the board itself. And that's consistent with best practice. And so a disinterested director here means neither that director nor their family members can have any business dealings with the medical system, to ensure, again, that it's just fidelity to mission that those folks are looking out for. Lisa and Donna mentioned some other policies at the management level around contracting management, our training and education program. We're obviously doing periodic audits to ensure that all the changes we're talking about are actually being properly administered, executed, and adhered to. So again, it's iterative and we're constantly learning and trying to make sure that we're validating that we are doing the things that we say we will do. And I think in closing, I would like to just mention that we're very cognizant that we need to disseminate all of these changes across our entire system, right? The hospitals that span the entire footprint of the state of Maryland. So our conflict of interest policy has been adopted system-wide and uniformly. We have a policy around business expense and travel reimbursement for board members. In this time of COVID, it's probably not the most time-sensitive thing, but just ensuring that we have appropriate policies, rules, and checks and balances in place so that we can monitor and adhere to best practice. And I guess the last thing I would mention that, we developed a unified incident command structure in response to the coronavirus pandemic. And that's been a tremendous accelerant to our system, which I think historically grew up, as many of you knew or know, as sort of a confederation of states where there was maybe areas of autonomy or inconsistency in practice. And our COVID unified response has been a tremendous accelerant to our ability to act uniformly as one system with a fidelity to best practices whenever and wherever we identify them. So with that, I'll pause.
Are there any questions from any members of the subcommittee? I have a question to get us started. Ms. Atkins, you referenced the whistleblower protections. Is that something you do as a system? Is that something, just being curious here, I'm not saying I'm going to go to bill drafting at the conclusion of the hearing. Is that something that's required by law? What is the background for the whistleblower protections that you referenced?
I think whistleblower protections, there is, I think if you look at what the OIG recommends as a best practice and as part of the 7 elements of a strong compliance program, those whistleblower
thank
having, so the whistleblower program, I think is just fundamental to a good compliance program, and the ability to have that anonymous reporting is critical. And yes, to answer your question, Chairman Rosenberg, it is a system-wide policy and process that we have. And we're actually moving to consolidate each, as Aaron mentioned, part of COVID has really brought us together as a system. But what I've recognized is that we have different 1-800 numbers for the whistleblowers to call if there's a whistleblower, for people to report it honestly. So we're going to consolidate those into one common phone number, so that people can know the number to call, so that there's not discrepancy throughout the system. And it'll go to a central third party, so that there are no identifiers, but we'll be able to get those more quickly and more timely, so that we can respond appropriately and do the investigations as needed.
So this is a recommendation of the Office of the Legislative Auditor for UMMS. It doesn't apply then to any other entity in the state, whether it's nonprofit, whether it's medical system, so on. That's only something that has been required of you or recommended, but you have then instituted it. Is that correct? To your best knowledge?
I would say the Department of Justice would require it if they came in to assess your compliance program. It's the hallmark of a best-in-class compliance program.
Okay. Okay, thank you. Are there any questions from any other members of the committee? If not, we will proceed to the next set of witnesses.
Thank you.
Thank you.
We'll go to the next panel.
Hey, Sandy, it's Aaron. I wanted to follow up with you on House Bill, or last year's House Bill.
Thank you, Chairman Rosenberg, and thank you, members of this subcommittee, for the opportunity to present today. I recognize this is somewhat of an experiment for all of us to meet in this way, but I appreciate the time and effort that's gone into this. I have a brief PowerPoint presentation that I'm going to walk through quickly, primarily for the purpose of highlighting some materials that we have provided to the subcommittee already. I am the public access ombudsman. My name is Lisa Kirschner. I have been in this position since the program first started in March of 2016. And earlier this year, I began my second term, having been reappointed by our Attorney General. We can have the next slide, I think, Dylan. So I've covered my introduction. I've just begun my second term. My program was created by the legislature in 2015 at the same time it created the PIA Compliance Board. The two programs together are Maryland's only extrajudicial dispute resolution programs pertaining to Public Information Act disputes, and the Public Information Act, of course, being Maryland's chief open records law throughout the state. We can have the next slide, please. Every year, the Public Information Act Compliance Board publishes an annual report, which has been provided to you. Representatives from the board will follow me and have an opportunity to address you more particularly. Each year, the board has invited me as ombudsman to provide an update to their regarding the activities of the ombudsman, which are attached as an appendix to their annual report. So this year, the report of the ombudsman covering fiscal year 2020 is attached as Appendix C to this report, which I'll review. Many of you might be aware that the principal differences between our two programs are that my mission under the statute is to try to help requesters and agencies resolve disputes that come up on a purely voluntary basis. I have a very broad mandate to do that. I can take up any issue, dispute, or problem that a requester or an agency may seek help on, but I have no enforcement authority. My efforts are dependent entirely on the goodwill and good faith efforts of both parties. So as you can imagine, sometimes we have a lot of success in helping parties reach agreement, and other times parties simply have to agree to disagree. And I will loop back and come back and discuss that in a little more detail. If I can have the next slide, I want to also highlight for you that my office publishes periodic statistical reports in the form of this very colorful one-pager. You have 3 separate such statistical reports that are attached to Appendix C at the end, and they cover different time periods. So I wanted to highlight this for you because they will highlight for you the growth in the program since our inception. And you can see areas in which we have had some success and others where we are now facing some challenges. The first such report covers our program operations since inception. You can see we are reporting many categories of data: the types of requesters we have, the types of agencies we're working with, the type of issues and disputes that we're dealing with. A metric of importance to my program's success, in my view, has to do with how long it takes to get to a matter once it comes in our door and then ultimately come to some conclusion in it, whether that be a complete resolution, partial resolution, or no resolution. This statistic we have worked very hard over the past several years to get down. We're being impacted in this way by COVID to a large extent. Just one brief comment on, we report out on formal mediations that we handle. Those are disputes where there are 2 parties involved. 2 parties have agreed to try to reach an agreement about a dispute. And then we handle a very significant number of what I call help desk matters. These are typically not bilateral. They very frequently are instances in which a party contacts us proactively to try to prevent a dispute. So we consider them of great importance to the overall success of the program, but they tend to work a little differently. Most of our mediations are initiated by requesters, and in contrast, we have found that agencies are contacting us more and more often with what I call the help desk requests. Can we go to the next slide? This is a similar type of report. This just illustrates our work during calendar year 2019. 2019 was an extraordinarily busy year for us, both in terms of number of mediations that we handled and a very intensive project that we handled, which had to do with the preparation, a conduct of an agency survey that was requested by the chairman of the Senate Budget and Taxation Committee and the House Appropriations Committee chairs. They asked for us to survey 22 cabinet level agencies regarding their PIA handling and performance. They asked us to evaluate and report out recommendations having to do with how the current extrajudicial dispute resolution programs are working and to make recommendations in that area, and to also evaluate and make recommendations in the area of compliance monitoring. And we did that. So 2019 turned out to be an extremely productive and busy year for both the board and myself in that regard. Can we go to the next slide? And what we are looking at here is a statistical report on the first 6 months of 2020. So in this time period, we are definitely seeing the impact of COVID. Although my office continued to work, we had been pre-pandemic, we were working, did a good bit of our work remotely, both by email and phone. We were able to continue that. But in the midst of the onset of the pandemic, the changes that were wrought within agencies, and many other variables. What we found was principally affected is the all-important statistic having to do with how long it takes to resolve mediations. And you can see that in general, we are resolving a far smaller percentage within the modest time frame of, say, 3 weeks. We're down to 24%, whereas we had been close to 50% previously. So that's one of the immediate impacts of COVID. May I have the next slide, please? Our one-page statistical reports come with a front and back presentation. And you're looking here at the reverse side of our first 6-month report for 2020. And as you can see, it describes other activities that we're engaged in: trainings, outreach, publications, resources we've developed. We maintain a blog called Open Matters. We have a Twitter account. We try to tweet out news related to open government. And so you have that sort of description as well in your package. Next slide, please. I mentioned that in 2019, the Ombudsman's program and the PIACB jointly worked on a report concerning Public Information Act performance in the state of Maryland. We put that out at the very end of calendar year 19. And the recommendations in it became the basis for a bill that was filed in the 2020 session. That was House Bill 502. Some of you may recall that the PIACB representatives who are here today and myself appeared before the full HGO committee earlier in the year. We also testified on the Senate side. In a nutshell, it's a fairly lengthy report. It comes with a pretty good table of contents, I think, and a good summary. So I'm not going to rehash that, but some of the takeaways that I'd just like to highlight for this committee are that, number one, on the compliance monitoring front, which really had to do with questions about agency reporting and data, we found that many agencies are already tracking their PIA requests and disposition in some fashion. There was not a great deal of uniformity across the 22 state agencies that we looked at, but substantial data was reported out by each of those agencies. I'm happy to say that we got 100% participation by all 22 of those agencies, and our assessment of that data is contained in, I think, section 3 of the report. One of the takeaways from that data is that we think it would be very useful to the extent the legislature would like to have consistent and reliable data going forward, that it would be useful to add to the act provisions that would require agency to maintain certain data. So for example, if you want to know how many requests each agency is receiving, that could be a data field that would be reported. Most of the agencies that have high volume appear to us to have pretty sophisticated systems in place for tracking data already. And they were able to produce or extract that data on request. At the other end of the spectrum, for agencies that have very few requests, and I think there was even one that had no requests for the reporting period, they were able to put together the data on request simply because they did not have that many requests. So we concluded from this, together with a qualitative survey that we circulated to the agencies, that it is both feasible and desirable for agencies to periodically report on some basic data relating to their PIA caseload. On the enforcement front, we concluded that it is desirable for a number of reasons for Maryland to have a broader extrajudicial enforcement program than it currently does. The PIACB, as it's currently constituted, has a very narrow jurisdiction, which is limited to resolving certain fee disputes that are greater than $350, and then only to the extent of considering whether the fee is reasonable. There are fee issues, and in my experience in this office, are probably among the least often raised issues. Of far greater importance in terms of dispute resolution are issues having to do with exemptions, issues having to do with not receiving any response at all from an agency, issues having to do with receiving a compliant response, that is one that contains the required information, and a variety of other issues. When we, not having a broader remedy outside of the court system at this time has a number of negative impacts, including that from the point of view of many requesters, and the majority that I deal with are individual citizens who are non-lawyers for the most part. Having a dispute that is not resolved can lead to a certain kind of skepticism or cynicism about government, or a feeling that one's information requests are not being dealt with fairly, are not being dealt with in a reliable or straightforward way. And this, of course, is not good for anyone. It's not good for our process. It's not good for our governmental bodies, and it certainly is not good for our communities and the individuals involved. From the perspective of agencies, they too are hampered very often by disputes that cannot be resolved. One of the impacts of having an unresolved disputes is they may often become involved in unproductive and sometimes very hostile or aggressive communications with citizens. This can disrupt and divert from performance of other duties in a fairly negative way if they cannot be resolved. Sometimes unresolved disputes will lead to a cluster of new requests going in, which will take up more time on the part of the agency. And agencies too have their fair share of requesters for whom they find it difficult to deal for one reason or another. And at present, they don't have any remedy for most of the issues that come up other than anything that I can achieve on a voluntary basis or going to court. Why isn't court enough? Court is inaccessible for most individual requesters and for many businesses, for many advocacy groups, and even for the press today. From the agency perspective, they are not looking to go to court. They are looking to accomplish their missions. And very often, questions of public perception and creating further burdens will weigh against going to court. So as a result, my belief is there are relatively few matters that ever go to court in Maryland. There are some, but not many. And there are far more disputes than there are court cases, that's for sure. During our work, we came to, that kind of covers desirability. How to do this occupied a good bit of our report and study. Conceivably, there are any number of ways this could be done. We think the most cost-effective way is to build on the existing structure and to expand the board's jurisdiction so that it can decide PIA disputes that can't be resolved on a voluntary basis through my office. As a result of a very detailed case review that I did together with my administrator, we literally went file by file for every file we had handled since day one of our operations. We concluded that if this type of remedy were implemented, the board would see about 50 new cases per year, and that those cases would be relatively evenly split between those that could be resolved on a very summary basis and those that would require more intensive work. And based on our experience, we projected this could be handled with the addition of 2 new full-time staff. That was the basis for concluding this was the most cost-effective way to approach that component of our recommendations. From my perspective as the Ombudsman, and one of the reasons I've been so enthusiastic about this recommendation is that I anticipate it will have a great impact on my program. I think it will incentivize meaningful participation in mediation on both sides. I think it will create a structure that will allow me to manage the caseload in a far more efficient way, and will result in the distillation of issues that really do require a decision from a body with authority to do that. I mentioned that a bill was filed based on those recommendations. Earlier this year, there was testimony in both houses. There was a large amount of stakeholder participation in those hearings, as some of you might recall. There were a number of technical concerns raised mainly by governmental bodies that we attempted to address during the course of the session. There were a handful of technical amendments that were made to the bill as a result of consultations with groups such as the Maryland Municipal League and the Maryland Association of Counties and other stakeholders who were participating in this discussion. And as a result, we think we came up with an improved bill. Unfortunately, it was just at about the time that bill emerged, the amended bill emerged, that the pandemic hit and the session closed. So we haven't really had a chance to fully air that new and improved version of House Bill 502. We're looking forward to working with the legislature in the coming session, and we hope and expect there will be a bill filed to reflect and basically, hopefully, eventually implement those recommendations.
Are there any questions from members of the subcommittee or the committee? If I may, was the administration involved in working on these amendments to the bill? You mentioned MACO and the Maryland Municipal League. Was the Hogan administration involved, because they're also recipient of PIA requests?
I don't, to be honest with you, Mr. Chairman, I am not recalling right off whether we circulated a version of the bill to the governor's office. My office has certainly worked with the Office of Legal Counsel to the governor. But that is obviously the governor's office has much at stake, since executive agencies are the primary responders to Public Information Act requests.
That's certainly something we would ask about if there is a hearing. I'm assuming there's a bill, and then obviously there would be a hearing. So perhaps you could have that, your decision, you could have that conversation.
We certainly will.
Beforehand. Are there any other questions of Ms. Kirschner? Okay, thank you very much.
Thank you.
We'll now proceed to our third panel.
Thank you, Mr. Chair. My name is Darren Wigfield. I am a member of the Public Information Act Compliance Board. We also have with us the chairman of the board, John West, who is on the call as well. So our board has not, in the interest of time and the interest of continuing the conversation that was started with the Ombudsman's office with Lisa Kirschner, we don't have a formal prepared presentation for you today. We just want to discuss sort of our board's role and the dynamic that we have with the Ombudsman's office as it stands today, so that we can better understand the changes that the bill that Lisa mentioned propose. So as it stands today, the board and the Ombudsman's office both support the effort of government transparency and meaningful access that the people would have to the government's records, bearing in mind that the PIA applies not only to state agencies, but also to county and municipal agencies all the way down to your local office of your local government. So there are a broad range of capabilities among the agencies that we would interact with, and there's a broad range of capabilities among people who request access from those agencies. So as it stands today, anybody who has submitted a request for public information may contest the responses they get.
See, it says off.
By submitting.
And you're on.
By submitting a response to a request to our board, or they may submit a request to the Ombudsman's office. There is no codified requirement to go to the ombudsman's first and then come to our board. Although I would encourage any requester to work with the ombudsman's office first. She's very effective. The catch being, as she mentioned, any request that she gets, any complaints that she gets saying, you know, I requested this public information and the agency didn't reply, or they charged me an inordinate amount of money, or they redacted what I believe is an unreasonable, not me, Darren, but me, the requester, believe is an unreasonable redaction. In any of those cases, Lisa has the ability to reach out to that agency and act as an intermediary to help negotiate a resolution, to help the requester pare down their request or better understand what the responding agency is communicating to them, and to help the agency better understand their obligations. The catch is every interaction with Lisa and with the Ombudsman's office is voluntary. The agencies are in no way required to even answer the phone or return her calls. She has no enforcement mechanism at all. When her office was created, our board, compliance board, was also created, and we do have an enforcement mechanism. So we are able to order an agency to comply based on the opinions that we draft. The catch here is our board is very, very limited in the scope that we can address. We can only address complaints of excessive fees if the fee is over $375, I think, but or $350. The dollar value is not really our concern here. The concern is that's all we can do is if somebody requests information, because under the Public Information Act, if you request information and it costs that agency money to collect and give you the information you're asking for, you, the requester, have to refund them that money that the agency spent. We didn't want to create the General Assembly did not want to create a right to sap taxpayer dollars out of the federal state agencies. They wanted a right to access the information, but if there's a cost incurred because of that request, the requester has to pay that cost. The concern is, well, what if the agency says it's going to cost $10 million to request your information or to collect your information? The agencies could arguably artificially inflate their estimates for the costs and what they charge the requesters in order to stop the requesters from getting that information, in order to reduce government transparency. Right now, our board has the ability to intervene. If a person has requested information and they get a response back that it says it's going to cost an amount of money that that person thinks is unreasonable, they can complain to our board. Our board reviews the justification for that cost, and we can order that agency to lower its fee. But we cannot order an agency to waive a fee, which the PIA has requirements for when they might waive a fee. We cannot review a denial entirely. If the agency says, no, we're not giving you any of this information, or the agency says, we don't have that information, our board is not empowered to review that. If they redact a lot of that requested information, our board is not empowered to review that. If they take too long to respond, our board is not empowered to review that. Lisa's office can address those concerns, but she has no enforcement mechanism. So there's a big gap here between whereas Lisa is able to address a broad range of concerns under the PIA, if the agency doesn't want to respond, there's nothing she can do about it. And even though our board, it seems, was intended to serve as the compliance mechanism, our scope is very, very limited, only to accusations of artificially inflated fees. If you go to our annual report, you'll see that over the last couple of years, and this data is from earlier this year, from spring, when we went to Annapolis to testify on this bill before the pandemic hit. Since 2015, Lisa's office has had and addressed 900 complaints about the PIA. 900 people in the state of Maryland have requested information and been denied in one way or another, or felt like they didn't get the access that they were entitled. And 900 of those people had their complaints resolved by Lisa. Our board, which is a board of volunteers, we've had 30. Lisa's had 900, we've had 30. And even out of the 30 that did fall within our scope, and the reason we only had 30, by the way, is our staff filters the requests and to only include the ones to which our board is empowered to respond to. We got lots of requests for people saying, well, I needed this waived and it wasn't waived and I have a justification, or I needed this information and I was denied. Those requests never even make it to our board. Our staff are empowered to recognize that those are not within our jurisdiction. So for the few that did make it through, for the 30 that did make it through, even out of those, many of them would be multifaceted complaints. Somebody would say, well, I think this was artificially inflated, and I think this was excessively redacted, and I think that the response wasn't timely, or I'm not getting the data that I'm entitled to as a citizen of Maryland. Even in those cases, we would have to separate out, okay, we're going to only speak to the accusation of artificially inflated fees, and all of those other concerns that came through with the complaint will have to sit and be unresolved. And there's no extra step, there's no other remediation for the requester to go to besides going to court. I think it's important to recognize that the purpose of the Public Information Act is for government transparency, for the people to understand what our government is doing on our behalf and what kind of information they're collecting about us and what kind of records they have. But pardon, I lost my train of thought here. Oh yeah, it's not just the private citizens who are using the PIA to request their information. It's the media. Very often the request we get would be a representative of the Washington Post or the Baltimore Sun or any other news organization that is working on a story. They've requested information, and these are professionals. They know what the PIA is. They know how to apply it. They know how to follow the process, and they're getting stonewalled. And so even they would come to our board to seek resolution. But again, unless it's about an artificial fee, our board can't help. In a time during the digital age where fewer and fewer people are subscribing and paying for their news, in a time where the news agencies themselves, nationally, globally, are struggling with finances, is it really appropriate to have the PIA enforcement mechanism require that media organization sue in court and have to go through hiring attorneys and go through the legal process in order to get resolution, especially for an issue that may just be a single story? Often even large news organizations like the Washington Post and Baltimore Sun would choose not to go through that expense. All that this bill does is ask for meaningful enforcement of the public access laws that are already in the books. We're not asking for loosening of the restrictions about what access is releasable. We understand there are legitimate privacy and security concerns that are already built into the PIA about what should be redacted. We just believe that having seen hundreds of requests come in, having seen those requests go unresolved because our board's not empowered to resolve them, having seen them go unresolved because Lisa, despite her best efforts, has no, the Ombudsman's office, despite its best efforts, has no mechanism for forcing agencies to comply. There's a large gap here that is going unfilled. And we believe that the bill, which Lisa referenced, would resolve those issues by allowing our board to respond to those requests. The way that this bill, and we and our staff did a lot of research. We reached out to boards from a number of different states that have similar missions to ours, the different public access offices from states all across the country, to see what kind of models they had created. And based on their experiences, we believe we've come up with a solution that would provide meaningful enforcement, but also not cost the state a lot of money. Obviously, when you pass a bill like this, there's always a concern about the overhead that's going to cost the state. The model that this bill proposes requires that the requesters start by going with the Ombudsman's office and start by working with Lisa through her arbitration process, which doesn't have an enforcement mechanism under it. But we believe that the fact that agencies know if it doesn't get resolved by working with the Ombudsman, that they know that the next step would be to come to our board, then they have more motivation to work with Lisa and her office to get it resolved in an amicable way before having to come before our board, which would have actual enforcement powers. Using that model and based on the data that we've collected, which is all available in the annual report, we believe we could remain a volunteer board. Right now, our board is made up of 5 volunteers. One has to be an attorney, one has to have been a person who received PIA requests and responded to them on behalf of an agency. One has to be a member of the news media. So we have those people are nominated by the Maryland Press Association, and the other 2 are members at large. That board, we expect, would still, even with this enforcement mechanism, even with the increased potential caseload that it would have, we think we would still be volunteers. You know, we still think we would be able to handle the caseload that that would create on a voluntary basis, because this bill requires that folks work with the Ombudsman's office first. And so we think that the vast majority of issues would be resolved at that level, and that would leave us free to still remain voluntary in our role. The fiscal note on the bill that was out in the spring reflected that. It did call for some additional staff of the Ombudsman's office. Right now, the board shares staff with the Ombudsman's office, and we would still under this bill. Additional staff to help process those requests. But as far as the board themselves, we would not anticipate needing to deviate from being a voluntary board. In fact, as board members, and I believe Chairman West would agree, we anticipated a much bigger caseload. Right now, we get a case once every month or two, and we were expecting to be providing a much more meaningful voluntary service to our community than what we've been able to provide. So the bill, as I see it drafted, is called the Equitable Access to Records Act. I'm sure that as it gets introduced and we get into session, there'll be more conversation about it. But we want to take this opportunity to point out some of the concerns in our annual report in the context of there has been a bill written to address those concerns, and we wanted to make this subcommittee aware of it. So with that, I will offer Chairman West the opportunity to add anything if you'd like, and otherwise, Mr. Chairman, if you'd like to invite questions.
Let me just say a couple of things. Can you hear me?
Yes, we can.
Yeah, thanks very much. That was very well presented from both the standpoint of Lisa and Mr. Yes, what do we, and I appreciate your indulgence, Mr. Rosenberg. Yeah, I hope, you know, there are bills that are sitting there, I think ready to be acted on, or at least move forward. The House Bill 502 and the Senate Bill 590. And I'd like to impress that, or emphasize that we have a very talented board, I think. It's very diverse. It's got everything you'd want to have in a board of, you know, the diversity of what we do. And we really have been operating this way for 5 years now, very successfully, as far as our jurisdiction has gone. But it's a very limited jurisdiction. And we, I think, can remain as a board that is our volunteers and is costing the government zero. We would have, I think, some cost, relatively small, to add 2 members of a staff, but I think it's be well worth it. With regard to your concern, Mr. Rosenberg, about dealing with the governor's office, I think that we can, you know, we can help in that regard, perhaps, and we'd be anxious to offer any help we could get, or that is necessary. So with the 2 presentations from Lisa and Darren, we would like to submit to your folks and ask for serious consideration of going forward with this on that House bill.
Thank you, Chairman West. Delegate Johnson has a question.
Thank you, Mr. Chairman, and thanks for bringing this presentation to us today. Mr. West, you and Mr. Wigfield have both mentioned several times about how a cost to the University of Maryland would affect a volunteer board. I'm glad you're putting a process in place with Ombudsman, but if you could explain to us how a cost will affect a volunteer board or somehow insinuate that we may no longer have a volunteer board. If you could explain that to us a little more, I would appreciate that.
Darren, you want to take that? I couldn't, it came in broken up to me.
Certainly. Thank you for the question, Mr. Delegate. The concern from the initial bill, one of the concerns that was brought up was that it would cause excessive costs to the government because potentially the board's caseload would become so large that the board themselves would need to become paid, that we would be like other judges within the state of Maryland who have a salary and an income. We don't believe our caseload would reach that level just because of that dynamic requiring and motivating the agencies to work with the Ombudsman's office. We genuinely think that the vast majority of the cases would be resolved by the Ombudsman's office. And so our board is already, we joined the board anticipating a larger caseload than what we have now. And if this bill were introduced, giving us broader powers, of course, we expect that would increase our caseload. We just don't think it would increase it beyond what we as volunteers would be willing to continue to support.
Okay. Are there any other questions?
I want to follow up on that, Mr.
Certainly.
Chairman.
Certainly, Delegate Johnson.
Thank you. The burden of transparency here is on the University of Maryland medical system. So explain to me exactly how it would be the cost of the government, if you would.
So as far as the burden of transparency's impact on the agencies, so first of all, this bill in some regards might save those agencies money because the agencies also would benefit from working with our board rather than through the court systems and paying attorneys fees for that more expensive process. Also, please bear in mind, this bill does not provide access to any more information than what the PIA already provides access to. So if those agencies are following the law as it's written today and providing access to the information that they're required to provide, first of all, they are able to charge the requesters back for that information. So they are required to give the first 2 hours of time free under the PIA currently. And any additional time, they are able to charge that back to the requesters. So there should not be any additional costs to the agencies, assuming that they're complying with the law currently. If they're not complying with the law currently, then maybe it would be more expensive for them to comply with the law. But I wouldn't fault this bill as saying it's incurring an expense to the government by requiring agencies to comply with the law that's already on the books.
And that's exactly my point. That's why I don't understand how that would endanger a volunteer board. You're just one step in the process, correct? They still have the ability, if they're not happy with answers you get or not satisfied, they still have the ability to go further and challenge it in court. Is that correct?
Yes. Yes, and in fact, the bill as it's drafted currently allows them to bypass us completely. If a requester would like to go straight to the courts, they are not obligated to work with our board.
Okay, that's why I just don't understand when you talk about endangering a volunteer board. I don't get that at all, but thank you for the answer.
Are there any additional questions of either of these witnesses? If not, we thank you very much and would now call upon Board.
Delegate Hill has a question.
I'm sorry, who has a question?
Delegate Hill.
Please proceed.
Thank you, Mr. Chairman.
I didn't know that you did. Thank you.
Yeah, thank you.
See
And
you
I'm
now.
sorry, Mr. Wickfield, I'm just trying to, I don't know the bill you're talking about. This is a bill from the previous session. If you could give me the bill number, I can actually look up the bill. And I assume what you're saying is there's no change going into 2021 from what you all introduced in 2020. Is that correct?
No.
502.
We've made a few. We made a few proposals. Well, not we, but the delegate. It was Delegate Learman's bill. There are a few technical changes in it, trying to address some of the concerns that were brought up in the 2019 or the spring of 2020 session. But largely, it would be the same bill. I don't have that bill number in front of me.
Lindsay just passed in the chat for me. Thank you. So let me get clear. You mentioned a lot of issues, that the ombudsman has certain powers but no authority, that you all have authority but limited scope. So I just want to be clear. Are you saying this bill addresses all of those concerns or some of those concerns?
I believe it addresses all of those concerns. I can't think of any off the top of my head which it doesn't address.
All right, thank you. Okay, thank you, Mr. Chairman.
Thank you.
Mr. Chairman, this is Delegate
Yes.
Barron, if I might.
Please, yes, Delegate Barron.
Thank you. It's my understanding from reading previous annual reports of the board that you all do have additional recommendations that aren't or were not reflected in the bill that Delegate Learman sponsored this past session. So, for example, and maybe the tweaks you mentioned changes that, but for example, and correct me if I'm wrong, there was a recommendation for waiver of fees for inmates, requests from inmates. I believe there may have been a recommendation concerning hearing disputes about waivers in the public interest. And there may have been others that, and correct me if I'm wrong, were not reflected in the bill that you're referencing. And, you know, I'll tell you, I like those recommendations that you previously had in your annual reports. And so I would, if you could explain what's not in the bill that you have recommended, either in your latest report or previous reports, I think that might be helpful to the committee.
So to the specific, thank you, Delegate, for the question. To the specific cases that you mentioned, the bill does have, would provide the board the ability to consider complaints about waivers. So if somebody believes that the PIA should have allowed their costs for their information to be waived, and there are reasons outlined in the PIA for that, then yes, this bill would empower our board to address those concerns. Regarding inmates in particular, that's correct. When I said that this bill addresses the concerns in our reports, I specifically meant the compliance concerns, whereas I would consider the adding of a waiver specifically for inmates outside of the compliance realm, but specific to expanding the PIA itself.
Okay, are there any further questions? Thank you. Well, we anticipate that there will be a bill and that we will have a bill hearing, obviously, come session, bill hearing before the full committee, and then most likely consideration by this subcommittee. Thank you very much. We will conclude with presentation by Ms. Marshall, Lynn Marshall, Board Chair of the Open Meetings Compliance Board. Chair Marshall.
Mr. Chairman and members of the committee, good afternoon. My name is Lynn Marshall. I'm the newly appointed Chair of the Open Meetings Compliance Board. Ours is a 3-member volunteer board, and I was appointed both as a member and a chair just as of July 1 of this year, so I'm very new to this board. Just a bit of my background, I'm a practicing attorney and a lifelong Maryland resident, so I'm happy to be of service to the public and to help public bodies comply with the Open Meetings Act in this role. My fellow member is Nancy Duden, who was appointed in 2019. And the third member of our board recently resigned. So we currently have one vacancy. However, due to the small size of our board, our two members, Ms. Duden and myself, do constitute a quorum. So we are fully capable of continuing to address complaints and concerns during this time until another member is appointed. Mr. Chairman, the activities of last year's board are set forth in the annual report, which was posted publicly last month, and I believe a copy of that has been provided to your staff. My recall is there were about 29 complaints and about 22 opinions that the board issued. And that report summarizes those complaints that we addressed during the fiscal year 2020. We are not recommending legislation this year. We concluded that this pandemic year is just not a good time for achieving the careful consideration and input that would be needed to make changes or recommend changes to this broadly applicable Open Meetings Act. The local governments and entities from which we'd usually get input, of course, have urgent and emergent ongoing pandemic-related issues to deal with. And also we have yet to see how this period will affect open meeting practices. As the committee is aware, the Open Meetings Act affects a wide range of public bodies and it has many moving parts. So we strongly feel that recommended changes to the act should be made only after careful study, input from public bodies across the state, and by a full complement of the board. And on the subject of the pandemic, I would say that we are seeing some complaints related to public bodies, attempts to give the public access to their meeting during this time, during this ongoing pandemic, and the social distancing issues, et cetera, that are involved. Early guidance was given toward the beginning of the pandemic from the Municipal Attorneys Association and the Attorney General's office. That information was publicly posted, and I'm very appreciative of that. And I believe that was helpful on the broad principles, but we are seeing some logistical problems that are coming to our attention that have arisen. We are addressing several such matters now, so I won't be able to comment further at this time specifically on those. So that concludes my briefing based on my brief tenure on the board, and I appreciate your hearing from me.
We appreciate your service on the board, and we appreciate your presentation here today and your availability to us should there be any legislation or any issues during the session.
Thank you.
Are there any questions for Chair Marshall?
Yes, Mr. Chairman, this is Delegate Sample Hughes.
Please.
This is questions for Lynn Marshall. Did you or have you seen a theme in complaints? I know you have referenced some, and I know you said there's a report that's available. I have not read it, but I wanted to understand as far as with what we're going through as far as making sure the availability of the meetings to the public, et cetera. Have you seen a theme of what those complaints have been? Is it consistent across the board?
Madam Delegate, as far as during the pandemic or overall more broadly?
Yes, just recently. I was just curious what you have seen thus far, if any.
Just speaking very, very broadly and generally, we're seeing some complaints involving internet access, for one thing. In different parts of the state, internet access is better than in other parts, and public bodies that are attempting to provide public access through live streaming, et cetera, similar to what we're doing here today in this briefing, have had some logistical issues arise. So that's one thing that comes to mind. Also, I will say that we've been getting, or we tend to get generally, complaints about ability of the public to comment during public meetings. And that's something that's outside of the Open Meetings Act. So the board's not able to address that type of thing. You know, in a broad sense, what we look for during this time and in any time is good faith efforts by public bodies to comply with the Open Meetings Act and to provide the best possible access to their meetings by the public. And you know, I honestly have it appears to me that that's what public bodies are attempting to do during this extraordinary time. And, you know, it's our goal to help them do that.
Thank you. Yeah, I have been attending a couple of the municipalities and county government meetings, and you know, they are trying to do their darndest to figure this thing out as far as, you know, utilizing traditional telephone, the conferencing ability, and then also limiting the number of people within their spacing of the actual meeting room, which are and have been some places very, very small. So I was just curious as to what you were seeing by way of complaints, but thank you. And congratulations on your service to our community in this capacity.
Thank you, Madam Delegate.
You're welcome.
Thank you. Are there any additional questions? If not, I believe we shall stand adjourned. Delegate Hill, sorry, I see you waving, and then Delegate Johnson.
Sorry. Yeah, I put it, I guess I didn't know what, I put it in the.
We're fine. We're fine.
I want to go back to Ms. Kirschner, if I may. I see she's still on the thing. It took me a while to look at these PowerPoints because they're so busy. You talked about, so you've had this decrease from the initial 1646 and then 505 complaints. And in the 6 months of the pandemic, pretty much, or at least except for 3 months, whatever, it's 232. But you also noted that there's been a marked decrease in the time for closure during the pandemic. So it's really two questions. Number one, is the decrease in the number of complaints because our agencies are getting better and many of the complaints were repeat complaints from the same folks, or are they unique complaints? And are we just seeing a decrease for some reason other than we're getting better at doing what we do?
Thank you very much for the question. I think my answer may come in several parts. First of all, the 2020 report that we provided is for the first 6 months of 2020 only. Whereas, for example, the other periods we report for 2019, we report a full 12-month calendar year.
Okay.
And then, of course, the first report that I mentioned, which has the bigger numbers, are from Inception since March 30, 2016 through June 30, 2020, which came to 51 months. So they're not apples to apples exactly. What we did note in the narrative portion of our report is that the number of new incoming matters in 2020 is roughly comparable to the number of new incoming matters that we had in the first half of 2019. The number is about the same. Two things are really different, though, about 2020. One is the greater amount of time it's taking us to get those matters resolved, to get to them, and then to get them resolved. And then the other difference is that at the beginning of 2020, we had a much greater number of carryover matters from 2019 than we did, for example, going into 2019. And there are a number of different factors that impacted that number. But in a nutshell, we started 2020 with a large, nearly 50, not quite, may have been about 46, I believe, is from memory is what's in the report. That's how we started 2020 with roughly 46 open mediation requests. And then we add to that the new incoming requests. But the numbers of new incomings is roughly comparable. That said, we do see improvement in agency performance. So, for example, I don't see complaints about not getting any response to requests coming in from certain agencies and certain jurisdictions that when I started this job, I had a host of them. So I would say, yes, there is improvement. I'm aware of efforts that have been undertaken over the past several years by different county governments, municipalities, specific agencies to try to improve in performance, and that is making a difference.
Okay, great. And so, Mr. Chairman, if I may, so then what do you think accounts for, even in a pandemic, the difficulty in getting cases resolved now, or is it just due to things being shut down? And would you agree with Mr. Wickfield that the issues that you think make it more difficult for you to do your job the way it would optimally be done in terms of authority and all that are all the things that you'd like to see addressed in the legislation that was discussed earlier, the proposed legislation?
I would echo what Mr. Wickfield said in the sense that all of the recommendations that came out of our December 27th, 2019 final report, that was the very last slide I showed during my presentation, Delegate. And that was a joint report issued by the Compliance Board in my office that had actually been requested by the legislature. All of the recommendations in that report are reflected in House Bill 502, which, as I mentioned before, was amended during this session. If I understood you correctly, you are asking me how does expanding the board's jurisdiction impact my program?
So, right. Well, two things. Number one, there was an issue about, the bill does not give you the authority to require things, right? So that's not in there. There are also other things from previous reports that weren't in the 2020, as Delegate Barron has pointed out. So the board has spoken that they're pleased with the bill. I'm asking you in your ombudsman capacity. Yes. I get it, it's everything that was recommended in 2020. That's slightly different than is it everything that you would ask for as the ombudsman, right? So it could be that it's exactly what came out of that report, but it could be that there were things that never made that report.
Well, that is correct, Delegate. That is correct. In previous years, 2016, 2017, and 2018, the PIACB invited me to submit comments to it, and I did offer comments that go beyond or have a different focal point, if you will, than was addressed in our end of year report in 2019. So yes, and I have made comments that the handling of fee waivers should be reconsidered. There's not uniformity in interpretation by agencies as to how, for example, the indigence consideration or factor, what weight it is to be given in the mix of determining whether or not a request for waiver should be granted. And I think the clarification of that would be very useful to have. It would be useful to have whether or not the board has expanded authority. But yes, I've noticed in many of my comments about particular barriers and access problems that inmates have, and they are many. So yes, I have made comments in my comments in previous years. The report that we issued at the end of 2019 addressed things that the legislature specifically asked us to do. And they specifically asked us to look at extrajudicial enforcement. They specifically asked us to look at the state of compliance monitoring. So I can't say that this bill contains the entire full wish list of Lisa Kirschner. I can't say that. But in my opinion, the single most important thing the legislature can do to improve the performance under the PIA is to expand the board's jurisdiction. Okay. If you can only do one thing, I would ask you to do that one thing. If you can do other things, then there could be many other things to be suggested.
So, Mr. Chairman, I would ask, if it please you, I would like to ask Ms. Kirschner to just send a letter with her wish list, so we at least know she's got 900 cases, right? Yeah. She's a single person that handles 900 of the cases versus 30. I think it might be helpful for the committee to know what her wish list would look like. And I would ask you, Mr. Chairman, if that would be an appropriate request, if we could make that request. And then the final question again, Ms. Kirschner, was what accounts for the delay in closing cases that we're seeing at this time?
Yes, thank you for reminding me of that. I think there are a number of factors impacting response times and ability to mediate disputes during the pandemic. One of them is that many agencies are now facing new needs and new and unprecedented levels of needs. So for just to pull an example out of the air, the Department of Health, both at the state and local level, they really have their hands full with many pressing, unprecedented needs. Likewise, our school districts, they have critical needs that they've never faced before. And the list goes on and on. I think in the first months of the pandemic, many of us were simply trying to get our sea legs and to just figure out how we were going to do the most basic things that we had to do. Many agencies were scrambling to deal with new duties. Beyond that, agency IT departments are really heavily taxed during this pandemic. They are supporting entire agency staffs on a remote basis. They've had to get new software. They've had to train people in new software. And they're doing that at a time when they already have their hands full. So, so that said, I think there are a number of factors that are impacting. A third item I should mention is that when the governor declared the state of emergency in March, he, as part of his executive order, allowed agencies throughout the state to submit to his office proposals and requests to extend deadlines they were responsible for administering. And these requests, as I understand it, were reviewed by the Governor's Office of Legal Counsel. And if the Governor's Office of Legal Counsel didn't object to proposals to extend deadlines, then agencies were permitted to do it. And there are some agencies that have availed themselves of that process. And some of them have done it as a kind of a backup measure. They didn't know what their ability was going to be, so they wanted this in place. Others, and I think they are in the very tiny minority, but there are some that do not appear to be responding at all. So I think there are a host of reasons that are impacting connectivity, deployment of staff, and the kinds of issues that we're all being called upon to address.
All right. Thank you for spelling that out. Thank you, Mr. Chairman.
Thank you. Are there, I would suggest, Ms. Kirschner, in response to Delegate Hill's suggestion that before you contact us, I would suggest you also be in touch with the sponsor of the bill just to make sure you're coordinating your efforts and your priorities.
Yes, thank you, Mr. Chairman.
Pleasure. Are there any other questions from members?
May I just say something quickly?
Certainly.
If I may, and thank you, Mr. Chair.
Melnick.
Thank you so much. Thank you, everyone, for coming. If I may just give you some advice, it is encouraged this year that we pre-file our bills.
Yes.
And the deadline is actually, I believe, November 1st, if I'm not mistaken. Will you please communicate to the original sponsor ASAP to make that request?
Yes, I will. Thank you. Thank you, Delegate.
Thank you, Mr. Chairman.
Thank you. Good, sound advice for all of us. If there are no further questions, I want to thank all the members of the subcommittee and the full committee who attended. I think this was the first Zoom meeting that I was honchoing, so we survived, and look forward to seeing all of you either at future Zooms or in person, at least on the first day of session, if not before. Thank you. We are adjourned.
Thank you.
You did beautiful.